set a goal for my presentations. I want to try and tell you where I'm going to take you. And so my goal for today is to establish a shared understanding of the opportunities that I think that there are for social research and public health. And the name of the presentation is focused on finding health influencers. But as I started to work on this, I found that the work that we're doing it actually spans much broader than just finding health influencers and leveraging them. And so I'm going to take you through a couple of different examples. And while this might be speaking to the choir a little bit, I thought I would take a step back before we jump into social research and specifically for health and talk a little bit about the usership of social media. And so just a couple of broad statistics. They're probably all very familiar to you all across the major platforms. And specifically that it's compounded when you include mobile into this. And what's notable in the work that I do is there's always a conversation we have with our clients that says, what about the low SES? What about the hard to reach audiences? What about those people that don't have smartphones? And what we always sort of look to is the data that shows that in fact, it's not about the smartphone specifically or about the actual technology, because what we're finding is that whether or not you have a smartphone or a basic phone, low SES and minority groups are using the advanced features of those tools, and they have data plans associated with them. And so regardless of the sort of perception of use of mobile technology, it's becoming more and more and more important to our federal clients. This is probably a chart that you all have seen from Forrester, but again, in terms of expected growth for mobile and social, clearly they're the two leading areas. And in terms of some trends in social research within the social media space, more than 79% of businesses use social media sites to monitor and extract information about competitors, and we've seen many examples of that this morning. And more than 60% of the companies are planning intelligence projects. 42% of companies have social listening as a top priority this year, but only 32% of consumers understand that companies are actually listening to them. So why listen, and why listen in health specifically? We know that matching your social data with your other data, be it business data, be it consumer data, or be it your epidemiological data in health, helps to create more informed data-driven decisions. And in terms of public health, we know for a fact that family and social networks directly impact personal health decisions. And in fact, this is compounded when you look at the past flu season, and I'm sure all of you are familiar with the stories around how Google's data was able to more quickly track and predict flu incidence levels compared to that of CDC. This is just from business2community.com. There's a website called Sick Weather. It's able to see a 30% increase in flu chatter in October and therefore predict a worse season compared to the speed with which CDC was able to do it. I pause here for a moment because what the data shows, and I think this has been sort of the resounding theme all morning, is that while your data may show one thing, when you look at it or you slice and dice it differently, you end up getting a different story. And so while this may be true, and while the Google charts that align with CDC's incidence data, and I'll show you a screenshot of that later, while they do correlate quite a bit, what we find is that a lot of the Google search traffic was driven because of news stories and people going and finding out more about a particular news story. And what it ended up looking like is when you compare across seasons, it made last season look much worse than, for instance, even the 2009 H1N1 avian flu outbreak. And that wasn't actually true. And so we have to make sure, and again, like I said, we've heard this all morning, that as we're looking at our data, it's only giving us a slice of what the information is, and it is really important to bring those other data points in. So what are some of the things that Westat is working on? Well, we're using listening to understand the landscape. So as we venture in to work with a new client or we are trying to understand a problem, we're using this to sort of understand and sort of uncover all of the different issues around a particular health issue. And one example I'll give you is we're working with EPA, and they were very concerned about some of their studies having a lot of negative sentiment or conversation. And this was without them having ever done any online listening. And what we found is when we actually looked at the geographic area where the studies were being implemented, the conversation was in fact very negative. But when you compared that to the overall sort of share of voice of EPA, those voices were actually very small and not influential. And so again, being able to contextualize that conversation for them helped them to put it in a perspective that they hadn't previously had. We're using it to build relationships and change the conversation around health. And so this is where you sort of get into this idea of health, the health influencer. We're working with the Agency for Research and Healthcare Quality, not to look at mentions of their projects or their innovations or their tools or their brand even, but really to look at who are the influencers in this space and how can we then reach out and engage them. And it's been a very manual process, to be honest. We have a tool that we use in-house, but it is a very sort of looking at not just, again, how many followers you have or how many people you're connected to, but again, what is your influence level? And we're also using it for flu, and what we're doing there is we actually partnered with 2 different Twitter-based platforms and in order to disseminate messages this past season. And what we found was that depending on which network you tapped into, your messages actually had a greater reach, even though they may actually have been retweeted or tweeted by fewer folks, because one network was actually more influential than the other network. So again, we're looking at how can we take these learnings and kind of formulate our strategies moving forward to get these messages out to the people who need them most. We work with CDC's violence prevention campaign, Veto Violence, and for Veto Violence, we're using online listening to supplement our overall evaluation strategies. So it's a purely social media-based campaign. There's no other types of campaign elements going on for this. And so we've created our own kind of methodology for evaluating the performance of content on Veto Violence's social media platforms. And then we're supplementing that with listening in order to be able to show trends over time, and both from the sort of day-to-day sort of drumbeat of what's happening, but also to correlate with what we're doing and any spikes or drop-offs that we may see. We're looking at identifying share of voice when it comes to health campaigns. So for instance, and this is a slightly new concept for public health campaigns that I work on, where you definitely have competitors in that space, and being able to identify them and compare where you rank relative to those competitors to understand kind of who the major players are and where you are in terms of your influence. We're using our social listening to do this as well. We're also tracking negative buzz, and we talked a lot today, which was fascinating to me, about the nuances of negative buzz or negative conversation. We're doing this also for the National Institutes for Deafness and other hearing communication disorders, and mostly because a lot of these institutes fund grants, and the grants go to universities and other research entities, and oftentimes the research that they're being funded for gets any number of criticisms from the media and the general public. And so being able to look at social listening and informing the client around these are the things you're funding, and then these are the things that are being criticized online, not because they're going to go out and engage with the naysayers necessarily, but because they then are able to have informed conversations internally with their stakeholders. And this is something that I'm very interested in. As I mentioned earlier, Westat does large-scale national data collection and actually international data collection studies. And so what I'm very fascinated with is this idea of layering on this sort of social listening or social research component, where traditionally data collection has been, it's very tangible. You're collecting biosamples and you're collecting, you're meeting with people, and it might all get formulated into a tablet and aggregated at some point, but there's an element of not connecting that to what's happening online, and how can we maybe layer on that in order to have deeper understanding of what's going on or what's being said. So this is something that we're also starting to work on. And you'll note this is the Google flu trends map that was in the New York Times like 2 seasons ago that showed how Google's data tracked to CDC's epidemiological data. And what we did with this is actually we worked with Google this past season to use their real-time data in order to implement campaign efforts, and we were able to do so successfully. And because of being able to access that data in real time and being able to be nimble and responsive, we were able to run the most successful campaign that CDC and Google had ever done together in terms of flu. So just a couple of key takeaways. Social research offers opportunities for public health communication campaigns as well as research studies. These opportunities require both a wide and deep understanding of social media. So in my world, it tends to be a very knee-jerk reaction that social media equals Facebook and Twitter, and having people understand that there's a wide breadth and depth of tools in your social media or digital toolbox that you can draw on to better inform your campaigns is really, really important. It requires nimbleness and adaptability, which sometimes can be hard with the federal government, but it is definitely something where it's ever changing, and getting people to understand that not a strategy that worked 3 months ago or 2 weeks ago may or may not work now, and you need to be able to adapt to that. And ultimately, the field requires social media and research experts to come together for further testing and learning, and I think that we see a lot of that in some of the presentations today, maybe all of you in your work. One of the things that struck me in one of the earlier presentations, and we struggle with this at Westat as a company that leads and implements many different types of studies, but in the world of digital and in the world of you can capture every single tweet online, the idea that you can actually capture those, maybe you redact them, maybe you don't, but you put them somewhere, and you think that you're protecting people's personal identifiable information, you're not, because they're searchable. They can be copied, they can be Google searched, and that person is identified. And figuring out how do we solve that problem of using this data but still adhering to those research practices is a really big question, I think. So thank you.
We have time for some questions. Questions for Amelia? Here and here. Can you talk about what kind of tools and what kind of tools you use in your analysis?
Sure, yeah. He asked about what kinds of tools we do or we use. So the tools that my team uses, we actually have a proprietary methodology that we've developed, and then we supplement that with a Radian 6 tool, as well as we've worked with Topsy before and Crimson Hexagon. But I do know that, for instance, in terms of the larger Westat data collection efforts or large national studies, they actually do have a lot of their own kind of sentiment tools that don't necessarily draw on the social space, but do help them with the understanding of participant, respondent feedback and things like that.
Outside of Twitter, where else are you seeing conversation that you're listening to?
Oh, we're listening across Twitter, Facebook, blogs, news and media sites, as many, and then we kind of have a running list of people that are online publishers and influencers that we work with that cross into forums and things like that too. So it's a wide variety.
And your listening tools are able to pull sentiment from those sources?
Well, sentiment is pulled. I don't necessarily believe that a lot of the automated tools do that very well, the ones that we have currently, and so we actually overlay our own manual process of analysis. Yep, we're doing the sentiment analysis ourselves. Yep.
Well, when we talk about health, the issue of age is important. Mm-hmm. How much the fact that the older people generally use less this media may affect all this data collection? Do you have any numbers or feeling on that?
Yeah, I mean, it's actually a really good question regardless of age. I actually tweeted out a question earlier, and I'd be interested in people's thoughts on this, because one of the other questions in my mind and in a lot of the researchers' minds at Westat is, when the majority of people in social media are not the active participants. The active participants of social media are the minority. How can the data you collect be generalizable? How can it doesn't is not necessarily a national sample or a representative of the country or potentially of even the small sort of sub-target that you're trying to reach. And when you think about the respondent pyramid in research and the idea that the majority of people that are responding are up here, in social media, in traditional research, we try and get to that other part of it. And in social media, it's very hard to know who's in that larger section of the pyramid. When it comes to older adults, that's, I think, even, compounded even further because they're lower users of the medium, but it's not to say that you can't find them and you can't use them. So it's just, I think it's a looming question to me, regardless of who you're trying to reach.